What is the recommended rate for chest compressions in adult CPR? A. 80 to 100 compressions per minute. B. 100 to 120 compressions per minute. C. 120 to 140 compressions per minute. D. 60 to 80 compressions per minute. Answer: B. The AHA recommends compressing at a rate of 100 to 120 compressions per minute to maintain effective circulation during CPR. What is the correct compression depth for an adult during CPR? A. At least 1 inch. B. About 1.5 inches. C. At least 2 inches. D. About 3.5 inches. Answer: C. Chest compressions in adults should be at least 2 inches, 5 centimeters, deep but not more than 2.4 inches. What is the first step when you find an unresponsive adult? A. Start chest compressions. B. Check for breathing and pulse. C. Call for help and activate EMS. D. Give rescue breaths. Answer: C. The first step is to activate the emergency response system to ensure help is on the way. Which location is used to check the pulse in an unresponsive adult? A. Radial. B. Femoral. C. Brachial. D. Carotid. Answer: D. The carotid artery is the preferred pulse check site for unresponsive adults. What is the recommended compression to ventilation ratio for one rescuer adult CPR? A. 30:2. B. 15:2. C. 5:1. D. 20:2. Answer: A. One rescuer CPR for adults should follow a 30:2 compression to breath ratio. When using an AED, what is the next step after turning it on? A. Begin chest compressions. B. Apply the pads. C. Deliver a shock. D. Check the pulse. Answer: B. Once the AED is on, the next step is to apply the pads to the patient's bare chest. If a victim is gasping but has no pulse, what should you do? A. Provide rescue breathing only. B. Wait for normal breathing. C. Begin CPR. D. Give oxygen. Answer: C. Gasping is not normal breathing. Begin CPR immediately if there is no pulse. What is the preferred method to open the airway for a victim with no suspected spinal injury? A. Jaw thrust maneuver. B. Head tilt, chin lift. C. Neck extension. D. Turn the head sideways. Answer: B. The head tilt, chin lift is the standard method to open the airway when no spinal injury is suspected. What should you do after the AED delivers a shock? A. Check for a pulse. B. Resume CPR immediately. C. Deliver another shock. D. Give rescue breaths. Answer: B. Immediately resume chest compressions after a shock is delivered to minimize interruptions in CPR. For high-quality CPR, how should the rescuer position their hands on the adult chest? A. Over the lower ribs. B. On the abdomen. C. On the lower half of the sternum. D. On the upper sternum. Answer: C. Hands should be placed on the lower half of the sternum to generate effective compressions. What is the correct compression depth for an infant during CPR? A. 1 inch. B. About 1.5 inches. C. About 2 inches. D. At least 3 inches. Answer: B. For infants, compress about 1.5 inches, 4 centimeters, which is about 1/3 the chest depth. Where should you check the pulse in an infant? A. Carotid artery. B. Radial artery. C. Femoral artery. D. Brachial artery. Answer D. The brachial artery is used to check the pulse in infants. What is the compression to ventilation ratio in 2 rescuer infant CPR? A. 30:2. B. 20:2. C. 15:2. D. 10:1. Answer C. For 2 rescuer infant and child CPR, the ratio is 15:2. What is the preferred technique for giving chest compressions to an infant with 2 rescuers? A. One hand on the chest. B. 2 thumb encircling hands technique. C. Heel of one hand. D. 2 fingers. Answer B. The 2 thumb encircling hands technique is preferred for higher quality compressions in 2 rescuer infant CPR. What is the correct compression depth for a child during CPR? A. About 1 inch. B. About 2 inches. C. At least 2.5 inches. D. About 3.5 inches. Answer B. Compressions for children should be about 2 inches, or 1/3 the depth of the chest. If you are alone with a child who collapses and you have no phone, what should you do first? A. Leave to get the AED. B. Call 911 immediately. C. Start CPR for 2 minutes, then activate EMS. D. Wait for someone else. Answer C. If alone, perform 2 minutes of CPR before leaving to call 911 and get the AED. Which victim requires only rescue breathing? A. No pulse and not breathing. B. Has a pulse but not breathing. C. Has no pulse and is gasping. D. Breathing but unconscious. Answer B. Rescue breathing is given to victims with a pulse but no normal breathing. What is the correct rescue breathing rate for an adult with a pulse? A. 1 breath every 3 seconds. B. 1 breath every 5 to 6 seconds. C. 2 breaths every 10 seconds. D. 1 breath per second. Answer B. Provide 1 breath every 5 to 6 seconds, 10 to 12 breaths per minute, for an adult with a pulse but no breathing. What should be done if a choking adult becomes unresponsive? A. Give abdominal thrusts. B. Begin chest compressions. C. Give back blows. D. Perform a finger sweep. Answer B. If the choking adult becomes unresponsive, begin CPR starting with chest compressions. What is the universal sign for choking? A. Holding the chest. B. Hands clutched to the throat. C. Pointing to the mouth. D. Lying down. Answer B. The universal sign for choking is hands clutched to the throat. What is the best way to relieve choking in a responsive adult? A. Chest thrusts. B. Back slaps. C. Abdominal thrusts. D. Rescue breaths. Answer C. The Heimlich maneuver, abdominal thrusts, is the most effective method to relieve choking in a responsive adult. If an infant is choking and responsive, what should you do? A. Chest thrusts only. B. Back slaps only. C. 5 back slaps followed by 5 chest thrusts. D. Blind finger sweep. Answer C. For a responsive choking infant, give 5 back slaps followed by 5 chest thrusts. Which of the following ensures high-quality CPR? A. Shallow compressions. B. Fast and deep compressions with full recoil. C. Compressions with long pauses. D. Giving breaths first. Answer B. High-quality CPR involves compressing hard and fast while allowing full chest recoil. What is the maximum time allowed to check for a pulse? A. 3 seconds. B. 5 seconds. C. 10 seconds. D. 15 seconds. Answer: C. You should check for a pulse no more than 10 seconds to avoid delaying compressions. Which of the following can interrupt chest compressions? A. Rescue breaths. B. AED analysis. C. Checking the pulse every 30 seconds. D. Changing compressor every 5 minutes. Answer: B. Chest compressions may be paused briefly for AED rhythm analysis and shock delivery. How often should rescue breaths be given to a child with a pulse but not breathing? A. Every 2 to 3 seconds. B. Every 4 seconds. C. Every 5 to 6 seconds. D. Every 10 seconds. Answer: A. Provide one breath every 2 to 3 seconds for children and infants with a pulse but no breathing. What is the primary purpose of CPR? A. Restart the heart. B. Provide oxygen to the brain and vital organs. C. Prevent choking. D. Calm the patient. Answer: B. CPR maintains blood flow to the brain and organs until normal heart function is restored. Which is the first link in the adult chain of survival? A. Rapid defibrillation. B. Early CPR. C. Activation of EMS. D. Post-cardiac arrest care. Answer: C. Activating the emergency response system is the first step in the chain of survival. What should you do when using a bag mask device with 2 rescuers? A. One holds the mask, one gives compressions. B. One opens the airway, the other provides breaths. C. One seals the mask, the other squeezes the bag. D. Both alternate compressions. Answer: C. With 2 rescuers, one maintains a tight seal on the mask while the other squeezes the bag. What is the correct action if the AED advises no shock advised? A. Check pulse. B. Restart compressions. C. Deliver a shock anyway. D. Wait for further instruction. Answer: B. Immediately resume chest compressions if the AED advises no shock. Which action minimizes the risk of gastric inflation during rescue breathing? A. Giving large, fast breaths. B. Using a pocket mask with oxygen. C. Delivering each breath over 1 second. D. Using a BVM with both hands. Answer: C. Giving slow, gentle breaths over 1 second reduces the chance of air entering the stomach. When should rescuers switch roles during 2-person CPR to avoid fatigue? A. Every 10 minutes. B. After every 5 cycles of compressions and breaths. C. When the AED says shock advised. D. At the end of the code. Answer: B. Rescuers should switch roles about every 5 cycles, or 2 minutes, to maintain high-quality compressions. Which is the most accurate method to confirm effective rescue breaths? A. Listening for chest sounds. B. Observing chest rise. C. Checking the pulse. D. Feeling air on your cheek. Answer: B. Visible chest rise confirms that breaths are going into the lungs. What should you do if you are unsure whether a pulse is present within 10 seconds? A. Deliver a shock. B. Assume no pulse and start CPR. C. Give rescue breathing. D. Wait another 10 seconds. Answer: B. If unsure, assume the victim is pulseless and begin CPR to avoid delay. What is the recommended hand placement for child CPR using one rescuer? A. 2 fingers on the lower sternum. B. 1 hand on the center of the chest. C. Both hands on the lower chest. D. 1 hand on the abdomen. Answer, B. For one rescuer child CPR, use 1 hand on the lower half of the sternum if small enough. What is the first step in using a bag mask device? A. Deliver a breath. B. Squeeze the bag quickly. C. Position the mask properly on the face. D. Open the airway with a jaw thrust. Answer, C. The mask must be positioned correctly to create a good seal before delivering breaths. When is it appropriate to use an AED on an infant? A. Never. B. Only with adult pads. C. When pediatric pads and settings are available. D. Only if the child is choking. Answer, C. Use pediatric pads/settings for infants if available, otherwise, adult pads may be used if necessary. Which component is essential for high-quality chest compressions? A. Deep, rapid compressions without full recoil. B. Shallow compressions with frequent breaths. C. Full chest recoil between compressions. D. Fast compressions without a rhythm. Answer, C. Full chest recoil allows the heart to refill and is critical for effective CPR. Why is defibrillation important in cardiac arrest? A. It starts breathing again. B. It restarts the heart rhythm. C. It reduces pulse rate. D. It prevents airway blockage. Answer, B. Defibrillation delivers a shock to restore a normal heart rhythm in ventricular fibrillation or pulseless VT. What is the most important factor in successful CPR outcomes? A. Giving oxygen early. B. Checking the pulse every minute. C. Starting CPR as early as possible. D. Waiting for EMS arrival. Answer, C. Early initiation of high-quality CPR significantly improves survival rates in cardiac arrest.